Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts, coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vaughn Do Reynoso, and Dr. Henning Ansorg, the county's Public Health Officer. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Julia Townsend. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Do Reynoso.
Great. Good afternoon. Thank you, Gina. I'd like to start by acknowledging a situation that occurred at one of our community vaccination clinics last week. The Santa Barbara Independent reported that a 92-year-old undocumented woman was denied a COVID-19 vaccine. The reality of the matter is that this community member did not have an appointment to be vaccinated on that day. Nevertheless, I am sorry that this incident occurred. I want to provide additional information about the case in hopes that it will dispel fears of getting vaccinated in our community, especially from our undocumented neighbors. The community member was not able to receive a vaccine because she did not have an appointment. We manage our vaccines very carefully to avoid spoilage and waste. On that particular day, we were booked and did not have appointments available to offer when she approached our clinic. In special cases, we have vaccinated community members who had appointments but unfortunately forgot to bring some form of identification. Documentation will not be a barrier to vaccination. Ideally, we would have been able to vaccinate her when she arrived. The unfortunate reality of the vaccine supply challenge is that we're not able to offer same-day appointments. We only bring enough vaccines to administer to those who have appointments. And we offer as many appointments as we have vaccine available. And regarding needing identification at vaccination site, we do need to verify eligibility and county residency. We're asking for a form of documentation with your name on it. The name on your documentation should match the name on your appointment confirmation. So examples of acceptable documentation with your name includes a driver's license, a business card, work ID, library card, a letter from your employer or school, bank and ATM cards, electrical bill, matricular consular, pay stub, passport, money transfer receipt, Costco card, etc. Please note that the document does not need to be a government issued ID to receive a vaccine. Again, documentation will not be a barrier to getting a vaccine. I do want to add that this case does appear to be a rarity. Since the beginning, our team has been so very committed to process improvement to ensure access for every eligible community member who makes an appointment. We have been intentional about partnering with many trusted community messengers and tailoring our process to be to be inclusive. Our community vaccination clinics are careful and considerate operations that we carry out multiple times a week. We want to reassure our community members and encourage everyone to continue pursuing a vaccine opportunity when you are eligible. And with that, I'd like to bring up my slides. Thank you. So I'd like to share with you our vaccination rate. Today, we stand at 93% doses administered. Please note that last week, when we presented first and second doses administered among Santa Barbara County residents, regardless of where they were vaccinated, we have updated our data to reflect anyone who was vaccinated in Santa Barbara County. So now the data reflects doses administered to those that have been to those who have received from Santa Barbara County's allocation. So of the doses received, our county, in our county, 68,250. First doses administered, 42,576. Second doses administered, 20,832. Next. This describes our current vaccine distribution in Santa Barbara County. Still eligible to be vaccinated are the community members in phase 1A, which are the healthcare workers and residents who are 75 plus. Also, newly eligible beginning this week are community members who are 65 plus years of age. Of course, as we mentioned last week, we anticipated limited appointments available. And in addition to that, with this winter storm, we experienced unexpected delay countywide of the Moderna vaccine shipments this week as well. Coming very soon are the phase 1B, which means that we will be vaccinating next the emergency services, the food and agricultural workers, as well as the education and childcare. Next. Current weekly vaccine allocations for Santa Barbara. We have been noticed this week that 70% of vaccine allocated will be for those 65 plus, and 30% of vaccines allocated will be for educators and childcare, food and ag, and the emergency services. As you can see, the population of each tier and grouping is enormous, far exceeds the vaccines that we will be receiving. So this week's allocation again is based on what's known as the 70-30 formula. And we were just on a call this afternoon with the state. We anticipate that statewide, the implementation for the 70-30 formula is March 1st. It is unknown at this time that the details of how we will implement this. And in addition, you may have heard that 10% will be prioritized for teachers. And again, we are lacking information at this time. In addition to all these changes, in the next few weeks will be a time of transition for vaccine distribution as we await further clarification from the state about the move to a third-party administrator, Blue Shield. We have set our appointment as a county for March the 2nd to discuss with the state the implications for the public health department. And we will be sharing with our community more information as they are available. Next. I'd like to share with you the next few slides, the demographics that our EPI team just reported. And after the press conference, the full report will be available on our website. So so what I'm sharing with you are a few slides highlighting the information, the data points contained in the report. So this slide describes cases by age groups. So from March 2020 to December 2020, of the total number of cases, 17,678. The age group with the highest number of cases is the 20 to 29-year-olds. at a total case number of 4,489, followed by the 30 to 39 years old, and then the 40 to 49-year olds. The 0 to 9-year olds have the lowest number of cases at 595. Next. This is a comparison of our COVID-19 cases, hospitalizations, and deaths by age. The figure compares the age groups of Santa Barbara County population to the age group of cases and deaths and reveals several important trends. First, a greater proportion of cases versus the population were working age adults age 18 to 29 years. So that means 30% of cases versus the 21% representation in the population. And the 30 to 49 years had 33% of cases versus their 24 representation in the population. Second, most deaths occurred among older adults, and this percent was disproportionately higher than the population. Of COVID-19 deaths, 25% were among the 50 to 69 years old, and 67% were among the 70-plus-year-olds. However, 50 to 69-year-olds made up 22% of the population, and the 70-plus-year-olds only accounted for 11% of the population. Third, children accounted for fewer cases at 9% and deaths at 1% than their relative population at 23%. It should be noted that during this reporting period, most schools were closed for in-person classes. And as Santa Barbara County schools start to reopen, it's possible that more cases will be attributed to children. In the next quarter, our epidemiology team will closely monitor trends among children. Next. The slide shows relative race and ethnicity proportions of Santa Barbara County's population, COVID-19 cases, and COVID-19 deaths. COVID-19 had disproportionately impacted communities of color, highlighting racial disparities. While Hispanics and Latinos accounted for 48% of Santa Barbara County's population, they represented 57% of COVID-19 cases and 67% of COVID-19 hospitalizations and 50% of COVID-19 deaths. In comparison, whites represented fewer cases, 15%, compared to their population representation at 43%. Whites made up 39% of deaths. Many of these deaths occurred at skilled nursing homes and other congregate care settings, which have been highly impacted by the pandemic. While the SARS-CoV-2 is novel, the disparate impact of COVID-19 pandemic on Santa Barbara County's communities of color is deeply rooted in the historic and ongoing social and economic inequalities that lead to persistent racial disparities in health status. Next. The figure that I'm showing you represents all laboratory confirmed SARS-CoV-2 cases in Santa Barbara County through December 31st, disaggregated by occupation. The occupation with the most number of cases was retired, unemployed, likely due to the fact that skilled nursing homes and other congregate care settings have been disproportionately impacted by COVID-19. Other occupations with high frequencies included clerical and management, laborer, unskilled worker, healthcare worker, restaurant, bar, food preparation. Workers in frontline occupations and highly exposed industries are likely less able to implement isolation and distancing measures that prevent transmission, thus putting them at greater risk of contracting COVID-19. Next. We are seeing positive trends in our county. Our case rates are trending downwards. Our active cases are trending downward. And so I want to encourage everyone to continue to be vigilant in being effective. So please vaccinate when it's your turn. And remember the 4 W's. Please continue to wear your mask, watch your distance, wash your hands, and wait on gatherings. Thank you. And with that, I'd like to transition to Dr. Ansorg, our County Health Officer.
Thank you, Director Dorvinoso. Good afternoon, everyone. I'm very happy to report that our adjusted case rate for the last 3 days has been below 25 per 100,000 of population. If this good trend continues through the weekend, our elementary schools, grades, transition kindergarten through 6th grade will be able to open for in-person instruction possibly as early as this coming Wednesday, January 23rd. We will reach out to the superintendents and other leadership from all affected schools and school districts on Monday evening to inform them about the ongoing case rate and the consequences that may have for them. We have currently 6 public school districts and 1 charter school who have completed an appropriate and very well-written safety plan in our county. These schools will be allowed to open next week, providing we meet the case rate of less than 25,000 on Monday evening. In order to simplify this process of checking on 5 individual consecutive days for case rates, the state is going to implement the determination of case rate per week every Tuesday, together with a tier assignment. That will simplify things. Schools that would like to open, remember it's so far only transitional kindergarten through 6th grade. And if they have not finalized their safety plan with us and the state health department, they should do so. They will have a window, all schools will have a window of 3 weeks to open, regardless of our transmission rate. That means even if we creep up above 25, they still have the opportunity to open during those 3 weeks. If those 3 weeks pass and they haven't opened, they have to wait until our Tuesday tier assignment shows a rate of 25 or less. We are really excited about this new development because we know how important it is to get our kids back into school. Now, regarding school sports. Today, the state issued an updated guidance on youth sports and recreational adult sports. The guidance applies to all organized youth and adult sports, including school and community-sponsored programs, privately organized clubs and leagues. This guidance is aimed at giving communities guidelines on how to safely remain physically active while understanding and mitigating the risk of transmission of COVID-19 through these activities. The guidance will go into effect on February 29th. No, that we don't have this year, February 26th, and will allow outdoor high contact and moderate contact sport practice and limited competitions to resume in counties in the red tier and even in the purple tier, providing the county is at less than 14 per 100,000 in the case rate. Very specific guidance is provided for participants, coaches, support staff, observers, and inter-team competitions and tournaments. Safety guidelines are outlined, such as testing requirements for high contact sports in addition to wearing face coverings when possible, physical distancing, and hand hygiene. Due to the risk of transmission that will continue to exist with some sports in particular, the teams must provide information to parents on the risk, and parents must sign an informed consent which acknowledges this. We are really confident that this will be very welcome news to many young athletes, their parents, and coaches. The Public Health Department is available for questions, and the specifics of the guidance is posted online on CDPH, on the CDPH website. We are now open for questions, and please cooperate, continue to wear your mask, and let us get these numbers down so we can open more of our activities. Thank you for your attention.
Thank you, Dr. Ansorg and Dr. Do Reynoso. Before I open it up to media, I also wanted to add that CDPH guidelines are posted on recoverysbc.org. So where we've got COVID-19 business and individual recovery and information for reopening attestations for all of our industry sectors, those are at recoverysbc.org. So first up, we are going to Blake Devine with KYT.
So first question for Dr. Ansorg, I just wanted to ask if you could just speak a little bit to how great the news is that we will be able to open schools potentially next week with the elementary school level. Just speak to how much progress that shows that the county's made since that winter peak in mid-January.
Yes, I think it's tremendous. I honestly believe it is tremendous because, listen, we had such high case rates. We, not so long ago, we were having case rates in the 70 and 80 range. We had active cases of like above 3,000. Now, we are down to having an active case rate of 500, I don't know exactly how many, but in the 500s, that's much reduced. Having said that, it is much higher still than ever in our summer surge. So we are not out of the woods, but we are seeing a beautiful trend downwards, and we really want to continue on that trend. That means we have to continue with our most important activities, wearing a mask. Whenever you are not home, wear your mask. That is really our best ticket to getting these numbers down, open up more of our restaurants and entertainment places, and especially get older kids in school as well. Because remember, we will only be opening up high schools once we're in the red tier, and that means a case rate below 7. So right now we are 25 or 24, but it's a very, very promising trend.
Going along with that, I know it's hard for you guys to predict, obviously, but when could we realistically reach the red tier based on the trends that you're seeing?
You know, it all depends on our collective behavior. The more people take this seriously, the faster we get there. Now, it's an interesting phenomenon. If you have less people who are actively transmitting the virus in a big community, and those people remain isolated and cannot really spread the virus to others because they don't get in contact with susceptible individuals, because the other individuals wear masks, or the people who have the virus stay really isolated and don't spread it, it takes really only a couple of weeks to get down. So it can be very rapid depending on our collective behavior.
And then we're about 10 days out from what was Super Bowl Sunday. Do we have any numbers to report from that? How did the county do overall with avoiding a super spreader Sunday, as you spoke of?
I will be able to tell you next Friday, because it takes 2.5 weeks to see the bump.
Okay, makes sense. And then I wanted to clarify, is it March 1st when we'll be able to see those sector populations start to become able to be vaccinated as well?
That is correct.
March 1st. Okay. And then do we know how many of the new phase 1B 65 plus residents were able to get vaccinated this past week? I know there was the delays, obviously, but do we have any stats on how many of those 65 up were actually able to get vaccinated?
I don't have that number. Maybe Director Dovrinoso, do you?
I don't have that number because our public health community clinics were largely canceled. We were only able to serve community members for who were in need of second doses. But among our providers, it's too early to be able to collect that data.
Okay, and then the New York Times also reported this week that too many vaccine doses were designated for nursing homes in many areas across the country. Now, a lot of states are trying to make sure that those extra doses get back into the vaccine program instead of being held back for nursing homes when they aren't needed. To your knowledge, is Santa Barbara County aware this is happening anywhere locally?
I'm not aware of it happening, but the state is rigorously controlling the quick turnaround time for use of vaccines. So, as a matter of fact, when we were allocated our original number, which was we received an allocation of 7,410, and by the end of the day, the state was able to augment. We're one of the 7 counties that receive an augmentation because of our effectiveness. We received an additional 1,570 vaccines, and that is the state's reallocation of vaccines, perhaps from other providers to counties that need them and can get them into the arms fairly effectively.
Awesome. Thank you guys so much.
Thank you, Blake. And next up, we are going to Tom Bolton with NewsHawk.
Thank you very much. My question today involves the adjusted rates of both the case rate and the positivity rate. Those obviously have both been trending down nicely, and yet the adjusted rates for both, the most recent data is from February 6th. So we're showing, for example, on the case rate, actual on February 15th was 14.68, and yet we're showing an adjusted rate of 27. When will we see those change? I mean, the data is 9 days old now.
I'm not sure if you have the right data point, but our data, we have last week's blueprint data listed, and the numbers it's from last Tuesday because the state runs that data on a every Tuesday basis.
Well, I'm looking at the community dashboard, I guess, which is what we've been told to look at for, comprehensive information. So I guess that's where I'm confused.
Okay, so Tom, I can take a look at what you're looking at after the press conference, and if it's not updated, we will make that correction. Thanks for drawing our attention to it, but we do have the latest information.
So the latest information would be from this past Tuesday?
Correct.
And so what are the the adjusted case rate and the test positivity rates for those periods?
So are you looking at the blueprint metrics? That's what I'm referring to.
Oh, well, okay, I'll follow up. Thank you.
Okay.
Tom, was that?
No, that's all I have. Thank you.
Okay, thank you so much. And next up, we're going to Laura Place with Santa Maria Times.
Hi, everyone. My first question is about vaccinations for North County residents versus South County. Looking at the community dashboard, it looks like South County, around 2,000 more South County residents than North County residents have been able to get at least a first dose of the vaccine. And I've heard some concerns about South County residents being able to access so many North County vaccines, people coming up from Santa Barbara to Marion Regional, for example, that it is kind of creating this big gap between the two groups. So can you speak to that a bit? Is that a concern that not enough North County residents are getting to access the vaccines available to them?
Um, that's a great question, Laura. We strive to present uh, opportunities to all county residents, and we have made efforts with our community partners as well as our healthcare providers to make that possible. As a matter of fact, we had an equity clinic in Santa Maria to serve the Guadalupe and Santa Maria 75 plus, and we did heavy lifting with our community partners to ensure that only North County residents in Guadalupe and Santa Maria are served at that particular clinic. For the most part, Marion Clinic, vaccination clinic is available to all county residents, just as cottage clinics are available to all county residents. What we have been able to control from an equity lens is ensuring that our neighborhood pharmacies that we've allocated to serve their immediate neighborhoods, and that is our attempt to ensure that neighborhoods are served.
And by neighborhood pharmacies, you don't mean like the agency called neighborhood clinics, right? You just mean any pharmacies.
Right. I mean, the Albertsons and the Vons and the Ralphs, those are our allocated pharmacies.
Okay, cool. And going off of that, with Rite Aid pharmacies, I know those are beginning to also offer vaccines throughout the state. Are there any Rite Aid pharmacies in our county doing that? And do they, if so, do they ensure that they're serving their specific neighborhoods, or is it kind of open to everybody?
The Rite Aid pharmacies and the are under a federal partnership, so we have both. We have both the CVS and Rite Aid in a federal partnership, which means that it's a direct relationship to our federal government, and the county is not aware.
Not aware, of how the distribution works, you mean?
Correct. We are unaware of the number of vaccines or the locations or the planning for future sites.
If I may chime in, they do, however, abide by our tier system. So it's not that healthy 42-year-old can all of a sudden go to Rite Aid. So they will follow our phase and tier system for who's eligible for a vaccine, even though they received a vaccine outside our allocations directly.
Okay, thank you. And my last question, thank you for taking all these, is about vaccines for educators and childcare workers. So like you said, a lot of elementary schools will be able to reopen for in-person learning next week. But it sounds like vaccines for educators, for most educators, won't be available till March 1st or even later, just because of the limit of availability. So what would you say to educators and childcare providers who are really concerned about contracting the illness, even though their district wants them to come back?
I'm happy to speak to that. I'm sure we both can take a stab at that. It is uniformly shown that, especially in elementary school, so in children prior to adolescence, that they spread the virus much, much less frequently than adults or teenagers. That is a fact, and it has various reasons. So therefore, these very good safety plans that all these schools have worked on with us, with the state, with the education department for months now, they are very robust. They have a really good plan in place. A lot of the schools have gained a lot of experience with having cohorts or smaller groups of children on their sites, which was not normal school activity, but nonetheless, it involved having kids there who were wearing masks, who kept social distance, and they had instructors there and teachers taking care of them as part of childcare. So they know what they're doing. They know what they're getting into, and we will do our best to help those educators to get the vaccine as soon as we have enough of it. And that is our commitment to them. But the CDC also has confirmed, and many countries are doing it safely with a good safety plan. It is not a higher risk than in your own family to catch the virus. So therefore, we feel strongly that it's in the best interest of the children and the parents to not wait until everybody's vaccinated, but to go ahead, especially with elementary school.
Okay, thanks so much.
Thank you, Laura. And next up, we're going to Grace McCormick with Santa Barbara News Press.
Hi there, thank you. So I have a question about, or a two-part question about the Pfizer news that came out today. I'm not sure who's best to answer it, but my first question is about the study that was released that the first dose of the Pfizer vaccine was proved to be a lot more effective than we originally thought. So in that case, is there any potential that the county will focus on administering more first doses instead of focusing on second doses? And then the second part to that question is about the storage requirements. Pfizer's request to relax those requirements and finding out that they don't necessarily need to be stored at minus 80 degrees or whatever that is. So what are your general thoughts on that? I know it's preliminary and they will need the FDA's approval, but what impact would this have on Santa Barbara County if it is approved by the FDA?
Yeah, let me take a stab at that. This is so far just a press release from the company. It's not a peer-reviewed, written up article yet, so it's really difficult to know because, as you know, the press releases are usually preliminary results and they have to be vetted by peer reviewed entities, and I would prefer to wait until we have that to make a comment on that. But it's been known that first shots have great effect. What we don't know, because the vaccine hasn't been around for long enough, is how long the initial immunity lasts. We are not in a position to change our strategy to do the Pfizer vaccine, ideally 21 days after the first shot, the second shot, and for the Moderna, it's 28 days. We are sticking to that because that seems to be the safest way to go about it. Now, with regard to the freezing requirements, we are in a fortunate situation that all of our providers who were willing to go the route of getting these deep freezers in place have been successful. And that's mainly the hospitals and bigger players, not smaller practices, obviously. And so they haven't had a problem with the freezing. So obviously, it will make things easier. I think if Pfizer indeed gets approved for less stringent freezing for storage, it will make it more competitive against Moderna, who doesn't have this in place. So obviously that would be good news, because then it will be easier to transport and move from place to place, obviously. So that would be really welcome.
Dr. Del Reynoso, did you want to jump in before we go to Grace's second question?
Yes. So, Tom, is Tom still on our call?
He is.
So, Tom, I'm taking a look at our dashboard because I was worried about the data that you mentioned. So the data is accurate on our dashboard. The case rate is reported with a 7-day delay based on the week ending. So data reported this past Tuesday on 2/16 reflects the data from January 31st to February 6th. Does that make sense? And we are more than happy to chat with you offline to explain how we report out the data. But the information should be in the info portion of our dashboard as well.
Thomas,
Yeah, I see that. It's just, yeah, it's just challenging when you see a daily rate of 14.68, and then the last data is from 9 days ago. I just don't understand. It seems like it should be getting updated more frequently, but it sounds like maybe it doesn't. So um, it's really hard to know where we are today when you're looking at data that's 9 days old.
Yeah, if I may chime in, you're absolutely right, Tom. And that's been an issue I've been grappling with myself. We have a 9-day delay. And because we're looking at a 7-day average in episode date, and then we need an extra 2 days for reporting. And that's why we have this 9-day delay. It's annoying, to say the least. And also, if you look every day and you look backwards, you will see that these numbers actually change. That makes it even more annoying. And that is just the nature of reporting by episode date. I've been educated about. I didn't know that myself. You need to be an epidemiologist to understand that. And what we do get, though, that is not seen here, is we get the daily dates and we write them down. And because if I look again a couple of days later, they have changed because they get changed retroactively because of the episode date, which is so difficult to explain for me. I apologize. So you're absolutely right. What you see is always a 9-day delay. And that's also why the state will switch to this once a week reporting. Then we know, okay, on Tuesday at the Board of Supervisors, we will get a tier assigned, and the number for case rate per 100,000 that is recorded on that day, that counts for the whole week. Understanding that it reflects the 9 days prior to that date. Does that maybe that makes a little more sense, but it's really very hard to look at episode date on a daily basis because it changes. But if you look every Tuesday, for instance, when we get the new tier assigned, then it makes much more sense. That's my 2 cents.
thank you both for that. And thank you, Tom. And I apologize to Grace McCormick from Santa Barbara News Press. We're going to go back to Grace.
That was my only question, so you can move on. Thank you, though. I appreciate it.
Thank you so much. Okay, so next up, I'm going to jump to KSBY, and then we have Daily Nexus and Two Tiempo Digital.
Hi, thank you, Gina. So I know we mentioned at the beginning of March, we will be vaccinated educational workers and farm workers and those who fall into that current phase 1B. Do we know the amount that the county will be receiving for those mentioned, or when will we know?
Sorry, I wasn't able to hear your question clearly. Apology, but could you
Oh,
repeat
no.
that?
Oh, yeah, of course. When do we know the amount of vaccines that the county will be receiving for those mentioned, like educational workers and farm workers?
So no, we know it goes, the other part of why it's so frustrating is that we don't know ahead of time. We only know the amount of vaccines allocated to us on a weekly basis. So for this week, we receive a total allocation of 8,980, which is a lot different from what we received last week. And moving forward, we don't know. We can't even anticipate.
Okay, and I know a lot of educators that I've spoken with are wondering why other places are able to vaccinate, like farm workers and educators, but we still can't.
Sure. So the ability of some jurisdictions to either vaccinate teachers or vaccinate farm workers or 65 really depends on the availability of vaccines in that particular county. And so for a large county, typically they have more multi-county hospital systems which get their additional vaccines. They have, perhaps because of their large population and demographics, they receive direct federal partnerships via CVS and Rite Aids. So it really all boils down to the number of vaccines and the sources that exist in that county. For our county, as I have shown in the previous slides, we simply don't have enough vaccines through the state allocation to be able to begin all the three sectors that we really desperately want to offer the vaccines to.
And then just the last question that I have, do we feel like we are getting the adequate amount compared to other counties?
Absolutely.
Okay.
So the state allocation, we track what we receive on a weekly basis. We run the charts, we analyze it just to make sure that we're getting our fair share, and per capita we are getting our fair share. But here I want to pause though. The number of vaccines coming to our county so far has been primarily through the state allocation. Last week, we were notified that we were one of the few counties that will be receiving a federal partnership allocation to our county healthcare centers and our partner CHC up in Santa Maria. So we can count on getting at least 500 vaccines a week from the federal government directly moving forward. So that's another infusion of vaccines into our county. So I anticipate that in the next few weeks to come, we will be seeing different streams of vaccines into our county, in addition to our main state allocation.
All right, thank you so much. That is all for me.
Thank you, Gina. And next up, we're going to Atmika Iyer with UCSB's Daily Nexus.
Hi, so my first question is for Dr. Del Reynoso. Last week you mentioned that in approximately 5 weeks, any resident who wants to get a vaccine should be able to get a vaccine. And I was wondering if that deadline has in any way been impacted by the delayed shipments, and with this new information, by help from the federal government as well.
I would say that it is getting better and better. So last week we were given right under 6,000 vaccines. This week we've gone up to we've received excess of 34% from the state, and in 2 weeks the federal partnership to our county clinics will start. So we will get an infusion of vaccines. So I don't know if in a few weeks, if everyone will be able to get the vaccine in the eligibility group, just because I think that the winter storms and the delays in mass production will hamper that effort somewhat.
Got it. My second question is that in November, we saw a decline in cases, and then Thanksgiving happened and the holidays happened, and cases began to soar. And so, seeing that we're kind of on the downward trend again, do you guys anticipate there being any events causing another surge in county cases? Or, and that in the context of competing with those surges to get vaccinated, do you think we'll be able to vaccinate populations fast enough to curb any possible surges?
I think two things. I want to applaud our community for doing their very best to be diligent with their masking, their social distancing, and their limitations on gathering. But I do want to say that for now, I don't anticipate major holidays happening around the corner. There is the spring holidays, and in which case I am hoping that our community has learned quite a bit from the last two major surges and that we can practice personal responsibility and continue the downward trend in cases and testing positivity. Um, with regards to half-ass, can we offer vaccination? You know, that's a really good question. I know and I am certain that we have the infrastructure. The only limitation is the receipt of vaccines in our county so that we can vaccinate and our partners can also vaccinate. We start our vaccination efforts in early part of December, and we have gained a lot of valuable lessons, and we have the infrastructure in place. Public health, the county public health, we can ramp up to offer at least 15,000 vaccine administrations a week. So can our partners, so can Cottage Hospital, so can Marion, and we've demonstrated that. So again, we have the infrastructure in place, we have the partnerships in place, we have the will in place, we just need the vaccines.
Thank you. My next question is, it's been around a month, if not over a month, since the Isla Vista Theater became a permanent testing location. Prior to it being a permanent testing location, it wasn't widely utilized. However, I think the reverse is true now that it has become a permanent testing location. I was wondering if you could speak to the success and efficiency of this testing location within Isla Vista.
We're more than happy to respond to a community need. That pop-up testing site is very unique. It is not on an appointment basis. It's on a walk-up basis, and we have seen the community respond to that framework of being able to show up, get in line, and get tested. We are seeing a tapering off somewhat in utilization, and we hope that the Isla Vista community will continue to use that as a testing opportunity. It has been very successful, that model, so we are duplicating that in Santa Maria.
Speaking of Isla Vista Theater, another unique aspect to it was that I know they definitely did this towards the beginning of Ivy Theater becoming a permanent testing location. I'm not sure it's still continuing, but they put into place an incentivized model where people coming to get tested could get little things from local businesses, whether they be drinks or gift cards. And I was wondering if you think that that model is a good thing to employ if incentivized testing could work on a more broad scale.
You know, I think that we want our community members to take the opportunity to get tested whenever possible if it's there. So if it's incentives, great. If it's walk up and no appointments necessary, great. If it's via increased location where it's convenient, we are exploring that. So I think that there is not one singular model that works for everyone. So we are very nuanced in the type and of the type and the facility of testing that we're offering throughout our county.
Thank you. My last question is, you guys have spoke about how Blue Shield will soon be taking over the vaccination efforts and how the county will be looking at serving populations within the described safety net. I was wondering if the county has put into place or formulated a plan on how they expect to do that.
Yes, so our EPI team has done its analysis, and we have estimates of the different community groups in our safety net population. So with that data, we will be guided to a strategy. One of those strategies is engaging trusted community messengers, trusted community leaders in outreach efforts. So we began last week by inviting various trusted community leaders to participate with us on a communication strategy, really identifying the different barriers in different populations, in different communities, so that when we get that vaccine, we will have the system, the process in place to address any of the barriers for the safety net population.
And thank you, Amica. Next, we are going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Okay, my first question is about the treatment for COVID patients because we still have a concern from our audience about this. Dr. Ansor, can you tell us what is the treatment for COVID-19 that the COVID patients have been receiving in the hospitals?
Yeah, there's a difference between the treatment in the hospital. If somebody is sick enough that they need to stay in the hospital, the treatment is different from when they are not quite as sick, but they could become sicker. And so let me speak to the treatment in the hospital. Usually people need to stay in the hospital when their oxygen levels drop. So they require pretty high flow oxygen, not with a ventilation machine necessarily, but just they lay on their stomach and they have very high flow oxygen, and that keeps, helps the lungs hopefully to recover. And sometimes they need this oxygen for quite a while. And then they get another medicine that's a dexamethasone, and that reduces unnecessary overshooting inflammation in the body. And then there are other medicines that are utilized if somebody is on a ventilator. Those are more advanced intravenous medicines that are given to fight the virus. Now, with regard to patients who have COVID and they don't feel so good, but their oxygen levels are still okay, there are certain medicines that have very complex names. Bamlanivimab is one of them, for instance, and it's now also approved with another one. And there's another combination of medicines. It also has to be given intravenously. And here in Santa Barbara, it's usually done in the emergency room, and it's good for people who have a higher risk of developing a more severe COVID disease, and it helps significantly in reducing that. So when somebody feels sick from COVID and they start to feel a little worse, I encourage them to contact their own doctor, or if they don't have a doctor, contact the emergency room and ask if they could be evaluated to receive this kind of treatment before they get too sick.
Okay, thank you very much. My next question, this is about vaccination. We've heard that some relatives of COVID patients have been vaccinated, even though they are not eligible. So do you know something about this, or maybe Dr. Van der Reynoso?
Yeah, it's unfortunate. It does happen occasionally, but it's really rare. Some people, because the vaccine at the end of the day has to be used up, it sometimes happened that people who were, for instance, at a pharmacy or somewhere at the end of the business day, and the clinic or the pharmacy had a couple of doses left over that would have otherwise been discarded or thrown away, that they, were rather giving it to somebody even if they were not eligible. But those people were not having an appointment. It was really the luck of the draw in most cases, and it's not a normalcy. That's not standard. So they can consider themselves really fortunate, but it's very unusual for that to occur.
Okay, thank you very much. That's all. Thank you.
Thank you, Fabiola. And next up and last is going to Brooke Holland with Newshawk.
Hi, thank you. I was wondering if there was any after hours COVID testing sites, let's say for people who might work multiple jobs and can't make it during normal business hours.
I believe that the latest is 7 o'clock, but that's a great idea. Worth exploring. So thank you for that suggestion. But right now we are the last one. The last appointment I believe is around 7.
Okay, and then my other question was after hours vaccination sites for people, for healthcare workers, or once we expand out to people who have multiple jobs. So that was a follow-up, but yeah.
Yes, also a great suggestion that we've also thought about. So public health is charged with making sure that the safety net population is served through vaccinations. So we understand that sometimes our various communities will need weekend vaccinations or evening or early morning. So we will be partnering with our various volunteer organizations, community-based organizations, and our team will be exploring the non-traditional hours for different community members.
All right, thank you so much.
Thank you, Brooke. And that does conclude our question session with the media and concludes today's press conference. Next Tuesday, the Board of Supervisors is holding a special meeting from 9 a.m. to noon on homelessness in Santa Barbara County. Therefore, there will not be a public health COVID-19 update at the board next week. Tentatively, we will hold a press conference at 4:30 p.m. on Tuesday. If so, it will be announced to the media and posted on public health and county social media accounts. Otherwise, the next public health COVID-19 press conference is scheduled for Friday, February 26th. For more information and links to the county's public health data dashboard that was discussed in tonight's press conference, as well as vaccine information, FAQs, informational videos, and more, please go to publichealthsbc.org. You can also call 211, select option 4 for information or to be connected to the county's call center. To reach 211 outside of the 805 area code, you can call toll-free 800-400-1572. So thank you for your ongoing patience and diligence to slow the spread of the virus in our community. And with that, we will see you next week. We wish everyone a safe and happy and healthy weekend. Good night, and thank you.
Good night.